So, because of our commitment to respect the human capacity for autonomy, we have said that those who have decisional capacity, that is to say, they actually have um, the capacity of autonomy, but those with decisional capacity have a right to participate in decisions about their health care and even to refuse life-sustaining treatment. But what are we to do about those who lack decisional capacity? Children who have not yet had time to develop it, the developmentally disabled who may never develop decisional capacity, those who as a result of some illness or injury have lost it temporarily or even permanently. In such situations, we have to move to what is called surrogate decision making. Someone else has to decide for the person without decisional capacity what should be done. How are we to think about those decisions? How are we to make surrogate decisions? What standards do we use or should we use in making decisions for others who lack decisional capacity? Well, in the case of people who have had decisional capacity and lost it, there are often advance directives, and certainly it's very important to have advance directives so that when one loses capacity, others are able to make decisions for you that are the ones you have expressed a desire for. So certainly when we are dealing with a patient who once had decisional capacity and has an instruction, what's called an instructional advance directive, sort of saying, if I'm in this situation, I want this, if I'm in another situation, I want that, or don't want that. Our first obligation is to honor those instructional directives. Now, be sure when you read in Post and Bluestein, read their sections about some of the difficulties and problems associated with such advance directives. But still, we start with the idea that we should honor those advance directives. What if a person has had decisional capacity but has never provided us an instructional advance directive? Well, then the idea has been that we should use what's called substituted judgment. We should imagine, based on what we know about the patient, what we know about their values, what we know about their risk aversion, we might say, and we try to substitute our judgment for theirs based on their values and their perspective. Some have suggested that a better way to think about this is in terms of authenticity. We should make decisions based on what is authentic to that person and to his or her own values and own previous choices. Of course, there's a third possibility. What if we don't have an advance directive? We don't know enough about the person to be able to make a substituted judgment or one that's authentic to who they are. Suppose it's a very young person who's never had the opportunity to develop decisional capacity. In that case, the idea is that we make decisions based on our own best appraisal of what's in that person's best interest, what is best for them, without regard to their own wishes, because we have no way of knowing what their wishes are or would be.